family, we have 10 pets. They are 3 Westies, Saffron, Belle and Beau, 5 tortoises, Herbie and Bernadette, Amy and Sheldon and Penny, and we have the 2 rabbits who are Poppy and Daisy. And the fact that there is several dogs I find really helps, because we've got several children and everybody can have a cuddle at the same time and everybody can get that attention really. The children that we've had and young people that we've had have often spent more time with the dogs initially, because you can have a chat if you want to chat, you don't get quizzed, you don't get asked anything, and they're just lovely company. So this is what we call the den, and it's our semi-independent room, but this goes down really well. It's got its own entrance, it's got its own set of rules. It is somewhere to practice being independent but safely. We're all in the house, they've got access to the house all the time. I've got a key for the den as well, so it's still one home, but this is a separate area for privacy. We've got rooms in the house for younger, under 16-year-olds. This is probably my favourite and most important thing, and it's our welcome book. So we don't really discuss this book, it's just left on the child's bed and in their own time they just go through it. But what is so important to me, because it introduces our family, there's photographs of everybody that's in our house and a little bit about them as well, what things they like, how old they are. And I think that it's, in the early days, it can be so daunting, and it's who am I with, and it's actually really nice to have a little bit of an explanation, and they also can create talking points. Because food and meals are such a high anxiety area for nearly all of the children that we've had, I like them to know what's coming, and I like them to be able to plan and not worry about their evening meal. So we have a Monday to Friday system, and on Sunday I'll plan out what we're going to have, and they simply just tick their name if they want it. And I have found that since we've introduced this system, I'm not getting asked at breakfast what's for tea, because children were obviously concerned, they were asking the question, and it's there, they open it up, and it's really lovely because spaghetti bolognese always goes down really well, and on Sunday you can hear the little whispers, I can't wait till Wednesday. Before a new foster child comes to join our family, it is an anxious time, but I would say it's more exciting than anything else, and we've got a lot of trust in the county council for matching us to the right placement. So before that child arrives, we don't question, are they right for us, because we're confident that they will be. I would say to people thinking about fostering to ring the local authority and ask as many questions as you can. When I tell people I'm a foster carer, a lot of people immediately say, I've thought about that, or I want to do that, and haven't. And I'll always question, well, why did you not make that call, or why did you stop? And it's often a fear that could be just, I don't know what the word is, it could just be resolved so quickly, and sometimes just asking questions and makes you realise that the things you're worried about aren't really there, or you can speak to somebody that's experienced it and gone through it, and have come out the other side and think, actually no, it is a really rewarding thing to do. I can't see myself doing anything different.
Okay, can you start the live stream now then, please? Okay, good morning, everybody. I'd like to welcome you to this COVID-19 Resilience, Recovery and Renewal Committee. It is being held remotely, as you know, so it's being broadcast live and recorded for publication for the benefit of viewers. Joe, would you like to just go through the members and officers who are present today, please?
Thank you, Mr. Chairman. We've obviously got yourself here. We've got Councillor Bosniak, Councillor Ben Bradley, Richard Butler, Stephen Garner, Richard Jackson, Michael Payne, Alan Rhodes and Jason Zadrozny. And as well as myself, we've also got the following officers who are present today. We've got the Chief Executive, Anthony May, Director of Public Health, Jonathan Gribbin, Service Director, Derek Higton, Service Director, Matthew Neal, we've got Group Manager, Rob Fisher, and we may be joined by Nicola McCoy-Brown as the meeting progresses.
Okay, thank you very much. So let's deal with the minutes of the last meeting. Can somebody move those as a correct record, please? They're from the 3rd of November. Thank you. Okay, Steve, thank you very much. Thanks for that. Apologies for absence then, Joe, please.
Thank you. We've had an apology from Councillor Mrs Cutts, who's unable to attend due to other council business. She's being substituted today by Councillor Richard Jackson. We've also had an apology from Councillor Regidaire for personal reasons, and he'll be substituted today by Councillor Richard Butler.
Thank you very much. That's great. Thank you. And welcome, Richard. I think this is your first meeting. Thank you very much. Declarations of interest. So any declarations of interest from anybody, please? No, I'm going to take that as no declarations of interest. And now on to the regular item, which is the situational update, COVID-19 situational update. Jonathan, would you like to take over now, please?
Certainly, Chair. Good morning, councillors. I'll bring up on my screen a couple of slides to talk you through the current situation. Before I dip into this, let me first of all frame this by saying that I think probably the overall situation, we're very pleased to have observed the rollout of the vaccines, the Pfizer vaccine, starting in Nottinghamshire last week. And I think if we were to cast our minds forward just for a moment or two to spring, summer 2021, I think the availability of the vaccine now and its rollout gives us good grounds for some optimism as we look at well into next year. In the nearer term, as we roll it out, what we'll first start to see is that reduces the number of complications, and happily that it'll also reduce the number of deaths and indeed hospitalizations arising from coronavirus. So all of that is very good news. But if I turn to the rates for a moment or two, the chart that I've put up on the screen shows for you in the grey line how the rates have fallen across Nottinghamshire over the last 4 or 5 weeks. In fact, they've been falling since early in November. The brown line, which I've previously focused us on, is the rate amongst people aged 60 or over. You'll see that line has also reduced over the last month, or it's also fallen over the last month or so. But actually the reductions there haven't been as strong or as sustained as we would like to see. And in fact, you can observe it's partially hidden by the grey line, but you can see that it's leveled off somewhat. Now that's the situation across Nottinghamshire as a whole. What I'll bring up now is a slide for you which gives you the rates in individual districts and boroughs. In beautiful Technicolor, you can see the middle column here is the one that provides gives you the rates for all ages, and it's sorted into order, so with the highest rates at the top. So I'm afraid at the moment we have Bassetlaw at the top with a rate of 230 per 100,000. At the best end of the league table at the moment we have Rushcliffe which has a rate of just 74 per 100,000. So quite a big variation across Nottinghamshire between top and bottom. You can see that those districts at the top include Bassetlaw, Newark and Sherwood and Ashfield. These are all shaded in brown. That indicates that at the moment they fall beneath the threshold which previously was being used to identify areas that fell comfortably into tier 3 territory, but are well above the tier 2 threshold. Those in red you'll see fall short of the tier 2 threshold. The arrows here representing whether those rates have risen or fallen in the last week. You'll be pleased to observe that there are a lot of downward arrows, and that's indicating that generally things are moving in the right direction, not universally, but generally. However, if we move one column to the right and look there at the rates amongst over 60s, you'll see that we have a very wide range again, from Bassetlaw, which currently has a rate of 267 per 100,000, down to Rushcliffe, which has a rate of just 74 per 100,000 amongst people over 60. Now, those at the top end of on this column, you'll see are shaded blue, and that indicates that they're still, unfortunately, in tier 3 territory, and much of the rest of the county certainly in tier 2 territory, and some districts we've seen with reductions, others with some small increases. So that's the situation across the county. Overall, since this committee last met, things are now in a much better position, but those rates have not yet reduced to a point which is sufficiently, in my view, relieving some of the pressures in our local NHS. And if I may, I'll just come on to one other slide which gives one indication of that. Now, the writing on these slides will be too small for you, but don't worry about that. It's the overall shape I want to pick out. At the top, we've got a chart which shows the hospital beds occupied by COVID-19 patients, and in the pink, it's we're looking at Bassetlaw, and we're looking at a time period that runs from April this year right the way up to the present. And you can see that in Bassetlaw, the number of COVID beds occupied are still much higher than they were at the peak of wave 1. In the green in the middle, we're looking at Nottingham University Hospital, and broadly the same situation. So a picture in which the number of the beds occupied by COVID patients is reducing, but still well above the wave 1 peak, and a similar picture in Sherwood Forest in the blue at the bottom. And I think that's probably, well, that is indicative of the health and the care system in general. So a picture which is slightly better than a couple of weeks ago, but where the whole of the health and care system continued to experience some fairly severe pressures. And with that, Chair, I'll hand back to you.
Okay, thank you very much, Jonathan. So I'm going to formally move the recommendations which are on page 7 of your agenda pack. Richard, do you mind seconding those, please, in the absence of Ray?
Yeah, second that, Chairman.
Thank you. So I'm now going to hand it over. Has anybody got any questions or comments they'd like to make? Alan, I can see I think you've got your hand up. Yeah.
Chair, thank you very much, and thank you, Jonathan, for what you described as an optimistic message. It's good to have a little bit of optimism at the moment. But I think you'd expect me to raise the issue of Bassetlaw, both as a Bassetlaw representative and a Bassetlaw resident. It's clearly concerning to see that huge spike by comparison to the other districts in Bassetlaw and in Newark. So there's a pattern there in the north of the county. My understanding is that this is largely due to 2 particular outbreaks in Ranby Prison and in a food manufacturing site in Bassetlaw. Could Jonathan confirm that? And if those particular infections were taken out of the equation, would that bring Bassetlaw down to somewhere near where the others were, or is that a false premise? Secondly, I'm pleased to hear about the vaccines. Obviously, I might as well get all my questions in at the same time rather than keep coming back. Can Jonathan tell me where we are with the GPs accessing these? I know they are in some hospital settings at the moment, but where are GPs on accessing the vaccines? And thirdly, I think we're all thinking about what might happen with the tiers, and I don't expect Jonathan to make any predictions, although looking at what we've just seen, I think it's fairly safe. We can make a fairly safe prediction for the north of the county, although it all depends on whether we're taken as a whole county or whether the districts are going to be broken down. Some will clearly qualify for tier 2 if that was the case, but I'm not round that table, so I'm not part of that discussion. But it'd be interesting to know what the possible outcome of that might be, Chair. Thank you.
Yeah, thanks. So there's several questions there then, Jonathan. Do you want to answer those first, and then Joyce, I've got you next.
Certainly, yeah. Thank you for your question, Councillor Rhodes. You're quite right. The situation in Bassetlaw isn't as favourable as we had hoped by this point, and the rates there are significantly driven by the two outbreaks that you mentioned. One of them being in Ranby Prison, another in a food production facility, and my team are working closely with both of those organisations. I think there have been a total now of just over 90 cases in the prison if we go back over several weeks, and there are still, as we speak today, there are still currently and about 60 of those I understand being asymptomatic, and a further 23 cases amongst members of staff, and yes, many of those staff members also residents in the Bassetlaw area. So were we to remove those, yes, it would bring Bassetlaw much more in line with the rest of the county, I'm pleased to say. The situation at the food production facility, there are not as many cases there. Nevertheless, that's something that needs managing fairly closely, because obviously there's a much freer flow of those individuals in and out of the community. So those aren't numbers I'd be looking to, if you like, to strip out of the Bassetlaw rates. You asked about the vaccine rollout. A letter went out to primary care networks on Friday or possibly over the weekend, and my understanding is that was notifying the primary care networks to stand by, ready to receive the first deliveries of the vaccine, perhaps from the end of this week, but so that they are ready to start delivering those to patients potentially from next week. But the timings around that are to be confirmed, and I think I need to leave it to NHS colleagues to add further detail to that in due course. What I would underline is that the message going out locally and nationally from the NHS around the rollout is a request to residents not to call the NHS, but to stand by and wait to be called. And letters will either come out, well, they'll come out from a couple of different channels at the right time, but addressing patients in the priority order that's been indicated by the Joint Committee on Vaccinations and Immunisations, that I think has been well publicised in the media. And then thirdly, you were asking about arrangements around tiers, how Nottinghamshire might be impacted by that, and I think you noted that it's a government decision. They've made clear the kinds of criteria that they'll be using to make that decision later on this week. It does include the infection rates which I've highlighted, so the all age rate and the rates amongst over 60s. They'll also be taking into account rates of positivity, which also vary considerably across the county. And I think the strength and the direction of the change in each of those indicators. Finally, they'll be looking at NHS pressures, which, as I've noted, have eased somewhat, but still remain higher, more severe than they were at the peak of wave 1. So that represents a severe ongoing disruption to NHS pathways, not just operationally for those involved in the system, but for our residents who will be impacted by that. So I think when we take that into account, along with the relaxation of measures over the Christmas period for 4 or 5 days, and then into January, when we anticipate the phased return of students to the city and the southern boroughs, I think there are a number of headwinds which would, in my opinion, would make it quite challenging for the government in terms of the consideration it's giving to Tier 2. Final thing to say, the government will properly reserve for itself discretion to about the geographical basis on which they make the tier allocations. My understanding is that the sort of default position would be to think about large areas, so moving a whole county and not parceling it up into districts and boroughs. There may be exceptions to that, but that would be, I think, their starting point, and one from which my perspective, I would support them in taking that approach. Back to you, Chair.
Yeah, I mean, I don't know, like you, I don't know how they're going to deal with it, but I don't think they're going to micromanage in the sense that they're going to break it up into districts, nor do I think it would make sense. I think either the entire county and the city will stay in Tier 3 or will all come out. Joyce, did you want to go next? And then Ben, you're after Joyce.
Okay, yeah, I agree with that. My question, though, is around some worrying news that's come from over the weekend, where in London, the cases with the 10 to 18-year-olds or 19-year-olds has suddenly skyrocketed. And I wonder whether you can see that kind of trend happening in Nottinghamshire. I know it's not really reflected in the graphs that you've shown us, Jonathan, because that is a worry. Because I think we've always thought before that the younger people weren't going to be as affected as there has been. So I just want to know what your thoughts are on that and how we can mitigate against it in Nottinghamshire.
Yeah, thank you for your question. You're right about London and what's been observed there. And were I to bring up on the screen charts which break the county situation down into districts and boroughs, and then within each district and borough focus in on what's happening amongst different age groups, you'd also see that in some areas of the county, over the last 2 or 3 weeks, going back, I should say, a couple of weeks or so, we saw an increase in rates amongst secondary age school children. And that's something that we've kept a very close eye on. It's been we noticed it particularly around Gedling and did some follow up there to understand the schools that related to. So in terms of the second part of your question, which is really about the management of that, I think the kinds of measures that we need to have in place are those which our schools are currently deploying, even in these the closing days of this term, and that's making sure that there are really good arrangements in place within the school environment. Of course, we do know that that for so many of these institutional settings that we're looking at, and workplaces and others, notwithstanding the really good arrangements that may be put in place within those settings, actually a lot of the transmission happens out in the community, either within households or between households, and I think the same would be true of our young people as well. So even though we have the prospect, I think in 2021, of a degree of relief coming through that supplied us through the rollout of the vaccine, it's really essential that we keep going with all of the measures, all of the social distancing measures that we've been emphasising and promoting over recent months. That's going to be really essential to carry us through the springtime until we reach a point where we see some relief coming through from the vaccine, from better weather, and from other factors. Thank you.
Thanks for that, Joyce. Ben and then Richard.
Thank you, Chair. Just to kind of cover it again, I suppose I had the conversation with Matt Hancock last week about Nottinghamshire in particular directly, and what Jonathan said was very very similar to what Matt said, as you can imagine. The feedback, I suppose, from that perspective was that, as you can imagine, some MPs within the county were very keen to have a more localised approach than county-wide, given the variation in figures. So there will be some pressure on Matt from that perspective as the decision comes to be made. The question I had Jonathan, was around mass testing, and there's this perception in the community about delays. Obviously, it's been quite a few weeks now since that was first announced. Government kind of says that it's a negotiation, a discussion with local authorities, and that these things will be rolled out across all Tier 3 areas. Do you know, Jonathan, if that will still happen if we are moved into Tier 2? And B, what's your kind of perception in terms of a timescale or possibility of getting that sorted?
Thank you, Councillor Bradbury. So your question was specifically about mass testing. I'm wondering if for a moment I might broaden it out just to give a little bit of context and then come back to addressing your more specific question about mass testing. So this in the media, questions around mass testing or community testing, as I think the government has very properly shifted the language to, is very closely tied up with the rollout of lateral flow tests, LFTs, and we've heard quite a bit about them. And they're I think they're going to be a useful addition to our toolkit because they provide the facility to get a test result very quickly without the need to send off a sample to a lab. LFTs are being deployed by the government through a number of different work streams and pilots. Several of those they set out in the winter plan, which they published a couple of weeks ago. And that, for example, includes work streams to roll out LFTs to care homes, to reduce some of the risks associated with people visiting their loved ones in care homes. So those were some rapid testing work streams that were set out in the winter plan. And we see a number of those impacting Nottinghamshire. So to that extent, LFTs are being rolled out locally. We also have community testing, and that's what previously was being referred to as mass testing. And the government issued a prospectus, which we received a couple of weeks ago, which set out how we can engage and submit an expression of interest around being involved in community testing, and that may give us access to some additional support around that. My plan with that at the moment is to pursue that, working with regional colleagues, with a view to submitting an expression of interest that would give us access to some of the learning that's going on at a national level, and also to some of the resource which government making available. Finally, LFTs were also made available to local directors of public health. We were each sent a supply of supposed to be 10,000, although in fact we've taken delivery of more than that, and that was put at our disposal to deploy as we saw fit. Now, we put together some provisional plans around that. Those plans were very quickly overtaken by some of what I've just been describing to you, some of those national pilots which were then launched, and we found ourselves needing to go back to the drawing board to consider further how we might deploy them, because what directors of public health have observed in other areas of the country is a confusion of pilots. Pilot upon pilot, some of them nationally directed, some of them locally driven. And what we don't want to do is either to waste resource locally, nor to add confusion to different settings, receiving instruction from the Director of Public Health on the one hand, or from national organisations on the other. So at the moment, I'm working on pursuing community testing and submitting an expression of interest to secure some additional resource and help through that. I'm working with my counterparts in neighbouring local authorities on that. Working with Nottingham City, we've now appointed a programme director to bring some additional focus and pace to that. I'm pleased to say that she started in the last 2 or 3 started last week, so it's getting up to speed with some of that. It will be January at the very earliest before you see community testing deployed in any significant way across Nottinghamshire, and when we do, my recommendation will be that it's done in a very targeted way to address known needs, not in a kind of a blanket way where frankly, we can end up spending an awful lot of resource, testing a lot of people, but without a lot of value on the end of it. Thank you.
Yeah, thanks, Ben. Does that make sense?
Yeah, great. Good feedback.
Thank you. Richard, you're next, and then I've got Michael.
Yeah, thank you, Chairman. Follows on from Joyce's question a little bit, really. Some of the media reported about the issue with schools in London, talked about the bubbles within schools being up to 200-300 pupils. Is that happening in Nottinghamshire? My assumption all throughout this has been that the size of bubbles in schools was class size at the most, 30 odd pupils, which makes a lot of sense. So just interested in your thoughts on that. Secondly, once vaccines have got to, I think it's the over 50s, there's then to be a rollout to the rest of the population. And I just wonder what priority or what input we might have, but what priority you'd like to see in that, i.e., would that, rather than just a free-for-all, should that then be focused on frontline staff? And I'm thinking about teachers perhaps in particular, because I would assume that care staff would already have had it in the earlier stages. And then just finally, what's happening within the NHS? We've seen the figures for hospitalisations, but what about routine appointments for other issues? Is that still taking place, or is that now on hold again?
Thanks, Richard. Jonathan?
Thank you. So the bubble sizes within Nottinghamshire do vary. Don't think I've heard of any as large in a school setting. I don't think I've heard of any as large as 200 or 300, but they will vary in size according to the layout of the school, the size of the school, and so on. I think behind your question is perhaps an implicit suggestion that if you're creating very large bubble size, that makes the school very vulnerable. Clearly, when it only takes an infection to close down the school. I think our head teachers and school leaders are aware of that, but we do find slightly different arrangements in different schools. Members of my team working with members of Colin Pettigrew's team work closely with schools. We provide, if you like, a second line support to a helpline that's set up by the Department for Education to ensure that our local school leaders have the very best support and advice available. You asked about how the vaccine rollout might get prioritised after we've completed rollout to the initial age groups and vulnerable groups. I think at that point, it depends exactly how quickly that is achieved. Yes, I could imagine that there are key workers whom we might wish to prioritise thereafter. I think that by the spring, summer, we'll also be starting to get some evidence as well about the durability of the immunity which this vaccine, or indeed others which follow on behind it, give the population, and that will feed then into planning around recalling people, well, identifying whether recalls and revaccination is going to be required. But I don't think we'll have a fix on that until the summertime, and that will feed into the prioritisation that we do as well. I think lastly, you asked about how the NHS is faring more generally. Councillor Jackson, I'm going to give you rather a general update on this. So the data that I provided to you was about the hospitals. At the level of, for our hospitals, at the level of COVID bed occupancy that they're still experiencing, that does represent a fairly significant disruption to planned care pathways. So there will be people whose procedures are being deferred because the beds that they would need to occupy are currently occupied by people with coronavirus. That's for our hospitals. I do know that our local NHS colleagues would want me to emphasise really strongly that there are good arrangements in place for seeing, diagnosing and treating anyone who needs that urgently, and that anyone with any symptoms that are any concern to them should come forward without delay. And the local NHS will see to them. I understand that seasonal flu is running at a lower level this year than we would in an ordinary year, and I would imagine that's partially because because of the social distancing measures that have been put in place and the higher uptake of flu vaccine this year. I haven't got more precise information, I'm afraid, for you about exactly how our GP practices are doing. I understand that they feel that their workload is considerable, but I can't comment beyond that.
Thank you. Michael?
Yeah, thanks, Chair. I just wondered whether Jonathan could shed some light on how much attention we should give to the middle super output area data that is on the COVID dashboard. Jonathan, you will have seen over the weekend the press reporting by the Nottingham Post that in essence highlighted 5 areas within the county and city that I can't remember the phrase they used, but that people should be concerned about. If you look at the county as at today on the COVID dashboard, there are 2 areas in those middle super output areas. One is Arnold Town, which I represent, which is over the 400 in terms of its rolling rate, and also the Manton, Clumber and Elkersley middle super output area. They're both showing purple in essence, which is the highest level on the scale. But if you then drill down into the data, you're talking about 25 cases in that Arnold Town Centre area, with an increase of 5 cases from the last 7 days. So I just want to get some clarity from you, as a professional who's working with this data day to day. How much should we pay attention to that? And I guess and indeed, Jonathan, is there anything we can do on a granular basis in the way that you described with the work that was done with the secondary schools in Gedling to target that area, if it is, if we should be concerned about that purple that is showing for Arnold Town and for the Manton, Clumber and Elkersley area? And secondly, Jonathan, linked to that and just touching on the point you made about lateral flow testing, I think you're right to draw attention to the confusion. And I have to say it was deeply frustrating to see the announcement over the weekend about 67 local authorities that are now going to benefit from lateral flow testing from today, some of which have started lateral flow testing from today, specifically targeting individual areas, as per the areas I just referenced. And Nottinghamshire doesn't have a single council area on that list. Now, as you said, we were referred to in the winter plan and in previous schemes, but in this scheme announced over the weekend, the 67 local authorities, our colleagues in neighbouring Derbyshire have a number of different councils that are receiving those community lateral tests and will be in action today, and we didn't feature. And yet, I recall Anthony rightly drawing attention to the fact that actually we were very close to that tier 2 line, even previously when the government did its own assessment on its own figures. And I just, I welcome very much what you're saying. I recognise that all the staff are under, huge pressure, but there needs to be some real pressure put on the government here, and whoever is doing this work organisationally to make sure that community testing in a targeted fashion is put in place as soon as possible so that we can react to, the Ramsey prison incidents, the incidents we've seen in Bassetlaw, the incidents we might have in and around Arnold Town Centre. So I just welcome what you said about that, but deeply frustrating that we didn't feature in the government's 67 local authority list, given the hard work by everybody over the last few weeks.
Okay, yeah, thanks, Councillor Payne. So I've not seen the reports in the Nottingham Post over the weekend about how different middle super output areas fare. Just a quick comment on the jargon for colleagues. Middle super output areas are these small geographical footprints which statisticians divide the country up into. It's useful for people like me, but it can sound like gobbledygook. But if we think of them as a neighbourhood, that probably is helpful. So I have to say that I'm grateful to my media colleagues for the assistance they give to us in promoting to our residents some of the really important basic messaging around coronavirus and the things which are going to keep our residents, our families safe, people out of hospital and our businesses open. So I'm grateful to them for that. I think some of the reporting of numbers in relatively small areas isn't necessarily terribly helpful. Sometimes they have picked up on something which in our daily outbreak cell, which meets bringing together Public Health England's, my own team and people right across the system, it turns out to be something which requires focus or is already receiving some focus. But I have to say that there are other occasions when if you focus on numbers in a fairly small area, it can cause a degree of alarm but not necessarily throw a lot of light on the situation. So what I would come back to is the assistance we need from them, and which I welcome from the media. They have been generally extremely cooperative and helpful in making sure that that people are reminded about those social distancing measures, the basic hands, face and space messages. You asked you also asked about the lateral flow tests and their deployment in Derbyshire. So Derbyshire County are one of the local areas with whom I'm working closely to make sure that we get the learning from what they're trialling at the moment in Derbyshire County. In terms of what is available from government, there's no shortage of lateral flow tests available to me should I wish to deploy them. But there are a number of other considerations to LFTs other than simply the test itself. In terms of how well prepared we are in Nottinghamshire to deal with some of the outbreaks that you mentioned, for example, in Ranby Prison and elsewhere, what it's important that councillors and residents are assured of is that where people are symptomatic, we've got really good access very promptly to testing facilities to make sure that those outbreaks are properly managed. And that would be the case not only for the ones that you mentioned, but if it turns out that there is an outbreak, if there were an outbreak in the geographical area, in the neighbourhood that you mentioned, Councillor, we'd be able to deploy that testing capacity there locally as well. What I am looking at is how we can use lateral flow tests in a targeted way. What I want to avoid is, and which would be of very little value, is simply rolling out lateral flow tests in a relatively indiscriminate way, because giving someone a result of a test of itself delivers no value. What is of value if they test positive is them knowing and receiving the support that they need to self-isolate, and it's that breaks the chain of transmission, and it's that I'm particularly focused on. And we'll be working closely with Dean, my opposite in Derbyshire County, to understand how they're getting on and what we can then introduce into Nottinghamshire on the back of that. Thank you.
Chair, if I may, that's
Mike.
really helpful, Jonathan. I just think the press release that was released over the weekend was hugely unhelpful. It stands on the government website, and if you read it, it talks about 67 local authority areas, and it specifically references the community lateral flow test being used to drive down cases to move areas from tier 3 to tier 2. And so I've got residents that are saying, why didn't we feature in that list, Michael? You know, we're working as hard as everybody else. So it's not a criticism of you, Jonathan. I just think that the narrative placed on the government website runs in the face of what you've just really helpfully explained as the DPH, and that causes a huge sense of frustration. There's clearly immense experience, logic, science behind what you've just explained, but it flies in the face of what the government have got on their own website that was published over the weekend and has been reported in the press. And I know you're not responsible for that, but at the end of the day, that's the feedback we're getting as local members.
Sorry. No, go on, Jonathan.
So okay, so I'd be pleased for the narrative around this to focus very clearly on targeted testing. I think that's where there is value, and that's where councillors will want to bring proper challenge to me to make sure that the programme director and the other resources that I bring to bear on this move things forward at an appropriate pace for Nottinghamshire. What's been achieved in some other areas where testing has been undertaken on a much wider scale, Liverpool being the most prominent example, logistically was very impressive. They rolled out and deployed an enormous number of tests in a very short space of time. It's been held up as delivering Liverpool out of tier 3. If you look at when that testing was deployed, Liverpool had already come down from a rate of something like 750 per 100,000 to a rate of, I can't remember exactly, but something in the order of 250 per 100,000 or thereabouts, and was on a good downward trajectory. What they achieved was very impressive, but it was achieved with 2,000 military personnel and an enormous undertaking right across the city, and with a very high degree of political consensus and buy-in as well across the city. All of which are things that we can learn from, but actually the results of the testing itself on its own, I think there are still some questions and uncertainties about how much that on its own achieved. So I'd be very pleased to make sure that the narrative we use in Nottinghamshire helps residents to understand that this needs undertaking in a targeted way, and where someone tests positive, what is important is that they receive the information and the support to isolate. Thank you.
Yeah, and while we're on unhelpful narratives, I hope members agree with me. I was firstly proud of the fact that the United Kingdom was the first country in the world that actually rolled out the vaccine. That's incredibly good news, and much to the chagrin of a certain American president. But the narrative that went with it, and this was a bizarre thing to me, I think it should be a targeted rollout. I looked at the news, and there's bizarre stories of where one old boy had phoned up the Cromwell Hospital in South Kensington, and they said, "Oh, just come in." And he went in, and they gave him the vaccine. It gave the impression that you just phone up the local hospital and then you walk in and get the vaccine, which I don't think is true. And if it's not true, is not particularly helpful, I think, because expectations, I think, need to be managed here. And I think that's something that we need to do locally, even if the media are moving. We all want good news, and we're all proud at the moment that people are going to get this vaccine. But if everybody thinks they just phone up the hospital and turn up, I'm afraid we're going to be overwhelmed. Have you got anything to say about that? Am I getting that right there? We are going to target it, aren't we? It's not a case of just phoning up and saying, "I'm 83, I want the vaccine."
Yes, you're absolutely right, Chair. The rollout of the vaccine is going to be finely targeted. It'll be prioritised in terms of groups with greatest need. Largely that's on an age basis, but with some other considerations also blended into that. And yes, you're quite right. Andy Haynes, who leads our local integrated care system, was at pains last week to emphasise in polite terms that the NHS would be pleased not to be called by residents, but really asking residents to wait to be called. It's unfortunate that perhaps fueled by some of the narrative that you referred to, Chair, there have been some people locally who've called local NHS and really been quite rude and difficult with NHS staff because perhaps their expectations had been raised beyond what was reasonable. So yes, our message to residents needs to be a request to them, really, that that those who are eligible for the vaccine will be contacted, but please don't, please wait to be contacted. Don't reach out to the NHS. Thank you.
I think that's important. Ben, I've got you, but there's one other, and I can't see who it is. So if it's somebody who hasn't spoken before, can you make yourself known? If not, I'll go to Ben.
It was me, Chairman.
Is that Jason?
It is, yes.
Yeah, okay.
Thanks, John. Well, just quickly, following on from Councillor Payne's point and others, I'm just not sure I'm clear, Jonathan, on whether you support lateral flow testing as a principle and whether your view on it has influenced whether we're one of those 67 areas or not. And I think we've got to be clear for us that this is having huge implications on the tier number for us because of the economics, but also, I'm dealing with a number of educational places. I'll give you, for example, Ashfield Comprehensive School in my division. I've got some young people now who've only done 10 days learning in the last 2 months because they're having to keep going into different isolation because one child tests and stuff, and we don't know whether that's going to affect their grades next year, what the government's going to do, and let alone the economics and everything else. So I think we for me, I'd like to know whether you actually do support this or not, and whether it will affect whether we're one of these areas, so that we can work hard on getting out of tier 3. I think people are working, but I just think some clarity on that answer would be really helpful. Thank you, Chair.
Jonathan?
Yeah, thank you. So yes, absolutely, Councillor Zadrozny. The lateral flow tests, I think, are rightly deployed, are a really valuable addition to the public health toolkit, and it's for that reason that we've appointed a program director, and that her job card is to develop and drive that plan around the deployment of lateral flow tests for Nottinghamshire. Am I a sort of a fan of LFTs deployed in an indiscriminate way? No, don't think that's going to deliver much. It might deliver some headlines, but not an enormous amount of value. So what we want to do is to make sure that we can identify how to deploy them in a way that is really effective and which doesn't, for example, end up with situations where we end up testing a lot of people, some of whom receive a positive result, but who do not actually have the disease, because no test, even one as fast and as smart as LFTs, is perfect. And in a situation where prevalence in the county at the moment is reducing overall, we need to be, and we have schools, services and businesses struggling to keep open when staff have to go and self-isolate. We need to make sure that we don't send any more people into isolation than we absolutely have to. So there are a number of judgments to be made about this, and those are some of the things that we're wanting to work through quite carefully, so that in our haste to deploy a new technology, we don't actually create more problems than we solve.
Okay, thank you very much. I've got Ben, and then I'm going to probably draw this to a conclusion and go to the vote. Ben, would you like to ask your question?
Yeah, thanks, John. Just to come back again, following up from Michael and Jason. Jason kind of touched on the part of my question there. The suggestion from the Department of Health has been that part of the reason that it hasn't been rolled out early on in Nottinghamshire is because Nottinghamshire Public Health are less keen on it than other places. And I wondered how directed that approach is, i.e. are the government coming to us and saying you must roll out these tests in this precise way, i.e. you must have that indiscriminate mass testing, or is that something that, you know, if we kind of get on board and get the access to the testing, we can then direct on a local level? And the second part is around the narrative. Is it fair to say, because I agree with Michael that it's not correct or realistic to say that, you know, particularly at the minute, it seems to go around, you know, if we'd have had mass testing, we'd have been definitely moving into tier 2 this week. I don't think that is fair at all. And is it fair to say it's a more medium-term strategy, this kind of community testing, in that if you do find and isolate a high number of people, then, you know, maybe 2 to 4 weeks after that, then you might be in a position where you've kind of cut off a high level of transmission and you can move forward. So you're talking kind of 4 to 6 weeks worth of process in terms of rolling that out. Is that a fair description? Just conscious of trying to get that discussion right when it comes to talking to members of the public.
Yeah, thank you. So, Councillor, it was the latter of what you said. It is very much at the moment under our discretion about how we direct the deployment, and there are a number of other rapid testing work streams which are nationally driven, over which we have little direct involvement. One of those being, for example, the rollout of LFTs to care homes to enable care home visiting. So that's something which we don't have much discretion and control over. But in terms of how we go about community testing, that is something that we can direct. Nevertheless, it does require resourcing up to do that. It also requires us to work through some of the logistical considerations. Some of the clinical governance around this needs further thought, and that's why we're working in partnership with other local authorities so that we can learn from them. And there are also considerations about indemnity as well, because some of the ways that these tests can be deployed may involve the local authority taking on a level of risk which requires indemnity. And so some of those things need sorting through. I don't think any of them are insurmountable obstacles, but it'll mean that it's at least January before we're in a position to deploy LFTs. Thank you.
Mike, is that did you want to come back?
Just a request, Chair, if I may, because I think this has been a really helpful conversation and discussion, and certainly been helpful to hear firsthand from Jonathan in response to questions from a number of us about community testing. I think two things need to happen, Chair, almost immediately after this meeting. One, Jonathan, I think you need to set out to county council members your logic and thinking and the way forward, because we're all getting questions about community testing. And what you've said is definitely a different position from what we're hearing in the public discourse from ministers and what people are reading in their broadsheets and their tabloids and seeing on the TV. That's not to say that what you've said is wrong. Of course, we support you as our DPH, but I just think that needs to be set out to county council members so that they're well placed to answer questions from residents and businesses. And secondly, I really do think that people need to hear firsthand, Jonathan, from you as members of the public across Nottinghamshire, why Nottinghamshire's taking the particular approach that it has taken. And I think you've set out a really strong argument this morning about why we are taking that approach. But I think we need to, because if we leave a vacuum on this, members of the public are just going to stand there and say, well, we're hearing ministers talk about community testing and widespread lateral flow testing, but we're not seeing it here in Nottinghamshire, and we're seeing it advancing, across the border in Derbyshire, in Staffordshire, in other places down in the south, in Essex, places like that. So I just think those two things would be really helpful. Some sort of communication to all elected members in the county council around it, and something, whether it's an interview, whether it's a thought piece for the press from you as a DPH with your colleague in the city, just to set out some of what you set out this morning, because I've certainly found it very, very helpful to hear it from you directly in response to the questions, if I may make that suggestion, Chair.
Thanks, Mike. Before you answer that, Jonathan, Anthony, did you want to come in?
Yeah, thank you, Chair. Morning, colleagues. Only to say that I've listened really carefully to the questions and the gentle challenge of our position on lateral flow tests this morning, and I agree with Michael Payne that we should set this out more clearly for all of the members. Jonathan wrote to all members a while ago, but it was a while ago, and the world has moved on, so we need to refresh our narrative on this. And Jonathan has a weekly briefing in the media every Friday morning, so I would suggest that we use that narrative for the media briefing this week, but also just to rest assure colleagues that we are planning to roll out targeted community testing using lateral flow devices in the early part of the new year. The engagement and dialogue between us and government was the same as it was for every other tier 3 area. Some areas have taken it forward, some haven't as a result of that dialogue. That doesn't mean that we're not committed to it. And I listened carefully to Councillor Zadrozny's question, which I think is a fair one. We are committed to it, Jason. We want to make sure that we do it properly. And I appreciate with that there is there's a clear need to tidy up the messaging and the narrative. I suspect this is an issue that might come up at County Council on Thursday. Of course, members have an opportunity to put questions down about this. So perhaps in preparation for any questions that we might receive, we can prepare our narrative for Thursday. Then we can write to all members, and Jonathan can certainly use that when he briefs the media on Friday.
Thanks for that, Mike. Thank you very much for the officers for that. I think we've taken that on board. I think it makes sense. I think we've had a good debate here today, so I'm going to move on to the vote if everybody's happy with that. As you know, we have to do this individually because it's being broadcast. It's the only way you can do it. So, Joe, do you want to read out the names, please?
Chairman, Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Butler.
4.
Councillor Garner.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. That's carried unanimously, Chairman.
Okay, thank you very much for that, colleagues. We're on to number 5 now, which is the COVID-19 update as far as the county council are more concerned. This is less clinical. Derek, are you going to lead on this, please, for us?
Thank you,
Hi,
Chair.
Derek.
Thank you, Chair. Good morning, members. You'll be familiar with this report by now, I'm sure, and its format, but effectively it covers off the county council as an organisation and our response to the continuing pandemic, and it covers off both our departmental level responses across each of the county council's departments, and also highlights some of the recent performance in the face of the continuing COVID challenges of some of our key front-facing services as well. The report provides a range of kind of workforce information about impact in our response, and also provides a brief financial overview as well from the County Council's perspective, and ask members to consider the contents of the report. As ever, I and colleagues are more than happy to take any questions that members may have. Thank you, Chair.
Thank you, Derek. So you can see the recommendations on page 24. I'm going to move those formally. Richard, do you mind seconding those for me, please? Richard? Or anybody?
Yeah, Mr. Chairman, I'm happy to second,
Okay.
those.
Okay. Yeah, thank you, Richard. Okay, so any questions or comments, anybody? No? Michael, is that you yet?
Yeah, I mean, Chair, you know, these things, if you're not careful, can pass by, and this is clearly a very comprehensive report. And I just think, on behalf of the committee, we ought to thank Derek and Anthony and the entire team at the County Council. You know, Alan was saying earlier, we were just having a chat as Labour members. There's been an immense amount of work, you know, here throughout this year as we come to the end of the year. Christmas is obviously a time to spend with your family and your loved ones and your friends, which is going to be difficult for some people this year, not least our own staff. And I think it's often easy to forget that our own staff have had their own personal trials and tribulations to deal with at the same time as being on the coalface, you know, throughout this year. And I just think if you reflect back, the partnership working and the leadership shown by our staff across the County Council has been exemplary, from, you know, from Anthony, Chief Exec, senior leadership team, right down to the people who are doing the really difficult jobs on the front line. So I just think it's incumbent on us as a committee, as we come to the end of this year, Chair, to say thank you. You know, a heartfelt thanks to all of our staff. And I think this report really brings to life, you know, as do a number of the other reports in this meeting, the outstanding public service, and shows the very best of public service. So just wanted to say thank you, Chair.
Yeah, thanks for that, Michael. I appreciate that. We were having this discussion at the pre-agenda. What I'm proud about, I've always been proud about Nottinghamshire County Council, over and above whoever runs it, is we don't just provide statutory services, we go over and above. And as you say, in this committee, actually, you can look at some of the work that we've done here. It is tremendous and it is ongoing. So thanks for that, Michael. Richard, did you want to add anything? Richard Butler, you've got your hand up, but you seem to have frozen. Is everybody else just looking at Richard like I am?
Yes.
Richard, you appear to have frozen. It's a great picture, mate, but I think I'll have to move on to somebody else. There's one other. I can't see who that is, though. It's not coming in. So if you want to ask a question, can you wave, put your hand up?
It's me again, Chair.
Okay.
I've got a very poor signal, so I think it's probably interfering a little bit.
Okay.
Chair, I'd like to firstly associate myself with the comments that Councillor Payne made, and my group would. You know, I think we all owe an enormous debt of thanks to the staff teams who are going above and beyond day after day at all of our councils, and, you know, particularly those people who are dealing with vulnerable adults and social care. I think they're an enormous lifeline at the moment. So I do think we need to record a huge debt of thanks to those. And I think that was right and proper. Chair, my question is on paragraph 43, near the bottom of page 7. It refers to the reopening of the coronavirus fund, and I'd really like to thank the council for backing the call we made to reopen that fund. But I was just wondering if Derek could provide us with an update on how the remaining balance, I think it's just a little over £300,000, is going to be spent, please, Chairman.
Derek.
Yeah, thank you, Councillor Zadrozny, for that question. As the report says on paragraph 43, the community fund has been reopened up until the 1st of January, and the latest information that I've got is that we've now approved 272 applications overall, giving us a total spend of £720,000, and that reflects a partial take-up of the community fund in the week since it reopened. I think it's fair to say that we haven't yet been we haven't received an enormous volume of applications, and I think that reflects the impact of the first round of funding from the Community Fund, and also some of the other funding streams that have been made available, particularly around food support and food supply around the county over the last few months. We are still, however, receiving applications at the moment, and we're obviously, when we get to January, we'll be in a position then to reassess whether we wish to continue to keep the fund open, depending upon demand and the nature of the applications that we're getting. But thus far, of the applications that we've received, assessed and delivered, my understanding is that all of those that we've received and assessed have been approved.
Thank you very much. Richard, you froze. Did you want to?
I'm sorry, Mr. Chairman. It was entirely my fault. It wasn't a conspiracy or anything. The computer's working on battery, and I forgot to plug the mains lead in, and just at a crucial moment. But really, I was just going to pick up on the comments that have already been made, that despite this terrible situation we're all in, the council is in, life has gone on pretty much as normally as possible for all the services that that the council is responsible for, and everybody is to be congratulated on that. I think there's a danger that we, and as members, and dare I say residents as well, sometimes assume that everything's just going to carry on as normal, and as near as possible it has. So really, just to echo comments that have already been made, that I don't underestimate the amount of work and stress and worry that has gone on officers and members and everyone in these extraordinary times, and no doubt about it, we given the circumstances, this council has done a pretty good job, I think.
Yeah, and just to emphasise your point there, I suppose in one sense the committee and the way that we deal with these things is, if people don't recognise that there's anything different, we've done a good job. So I mean we are trying to keep society together in a small way. We are trying to keep Nottinghamshire going together. So I think what we're doing, there's a lot of work going under the surface here, I think. So thank you for the comments. I appreciate those. Alan, I think I've got you next.
Yes, thank you, Chair. Yeah, I mean, the problem with being in local government is, of course, you get fewer plaudits than you do criticisms, and I guess we come to accept that. I guess that, you know, all of our staff, and in point of fact, the staff and members of all councils have responded magnificently to this crisis, in my opinion, and the partnership working has been superb throughout, and our communities have benefited as a result. I guess if we were to fly that flag, people would just say, well, you're doing what you're paid to do, you're doing your job, and all right, let's take that. But I do think that it's worthwhile recognising what's been done. I fully agree with the comments that Michael so eloquently made at the beginning of this particular conversation. My question really is on paragraph 40 on page 17, and it references County Enterprise Foods, which of course is based in Worksop, and a service again that we should be very proud of. And under the winter planning arrangements, I'm just really wanting to be assured that the normal service that County Enterprise Foods provides over the winter, but more specifically over the Christmas period, to some of our most vulnerable residents in Nottinghamshire, is on track to be delivered, and that there are no issues around the availability of food, the availability of staff, and so on and so forth over that Christmas period and the broader winter period, please, Chair, if I can ask that question. Thank you. Derek?
Thank you, Councillor Rhodes, for that question. Yeah, I'm happy to provide that reassurance that we're in through County Enterprise Foods, we're in a strong position to continue to offer the service that's really valued by so many residents over the Christmas period. I think more broadly, what colleagues at County Enterprise Foods have done over the recent months in summer and autumn is develop a bit of a stockpile of frozen meals, both for use for the kind of core market, if you like, for local residents, but also for wider use as emergency food should it be required. That possibility is now looking less likely. But we've got a stockpile of around about 20,000 frozen meals at County Enterprise Foods. So should the need arise, we can quickly mobilise both our logistics networks, but also provide a significant number of meals to any vulnerable people that should need them over the coming months.
Thank you, Derek, for that assurance through you, Chair.
Anthony, did you want to come in?
Only to echo colleagues' appreciation to the employees of the County Council. I'd like to add my own appreciation to those colleagues, given that this is a public occasion on which to do so, but also to reciprocate and say thank you very much to our elected members who've been extraordinarily supportive throughout this and have offered us the appropriate scrutiny and challenge as well. I think this committee is a really good example of that. I think Policy Committee has followed suit. It's never allowed us to rest on our laurels, not that we would in any case, but I think the relationship and the partnership between officers and members has never been stronger here as a result of the work that we've done together on COVID. But first and foremost, of course, it is down to those colleagues who come into work every single day, regardless of circumstances and regardless of what's happening around them in their home lives. So I'd like to reiterate my thanks to them as well.
Yep, I think that's great. And, without going over the top, as Alan says, we're not expecting praise for this, nor we want any. But I think it is right that we praise the members. And I think a crisis like this has brought out two things to me. Firstly, how sophisticated local government is in this country compared to other nations. And secondly, how phlegmatic the British people are. I think really we've handled this extremely well. It could have gone anywhere, to be quite honest. But so far, it's been, I think, if you can say we've taken a positive out of a negative, then, so far, so good. Thank you very much for those comments, and thank you, Anthony. If you could pass those on to the members of staff, we'd appreciate that. Thank you, Derek. I'm now going to, if nobody else wants to say anything, I'm going to move on to a vote. Same routine again, please. If you'd like Joe to read those names out.
Thank you, Chairman. Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Butler.
4.
Councillor Garner.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. That's carried unanimously too, Chairman.
Thank you, members. We're on to agenda item 6 now, which is the role of the Local Resilience Forum in response to COVID-19. Rob, I think, Rob Fisher, you're dealing with this, is that correct?
That's correct, Chairman. If I may just give a couple of notes of highlights from the report. The purpose of this particular report is to provide members with background information about the Nottingham and Nottinghamshire Local Resilience Forum and its role in the local response to COVID-19. Our LRF is one of 38 in the UK, and it's a partnership of all local agencies that have a part to play in planning for emergencies and indeed responding to them when they occur. The report includes a list of partners, and these include the Blue Light Emergency Services, local authorities and health services, and many others, as you will see from the list, and many share duties under the Civil Contingencies Act. Now, the LRF itself is not a legal entity. It doesn't have powers to direct its members. It is a partnership of all who have a part to play. The multi-agency LRF response to COVID-19 is led by a strategic coordinating group, and that's been meeting since February. Indeed, the meeting last week was the 42nd in this series of strategic coordinating group meetings. The report sets out the working principles of the LRF COVID response and the management structure. And taking the lead from the discussion of the previous report on the agenda today, this report also details that the County Council has had a very prominent role indeed in the LRF response. Some of the highlights of that are listed in the report, but the list there is not exhaustive. There are a wealth of subgroups underneath those listed in the report, and the County Council contributes to and indeed leads many of those subgroups. The multi-agency structure identified in the report has been reviewed during the response, and it will be maintained until the COVID response and recovery has been completed. I think those are the key points from the report, Chair, and I'll be pleased to take any questions that members may have.
Thank you very much, Rob. So I'm going to move those recommendations, which are on page 28. Can somebody second those, please, before I open it up for questions?
Yeah, I'll second those, Chair.
Thank you, Richard. So I'm going to invite views now or questions from members. I've got Joyce, you're first.
It's just a comment really rather than a question, because when I look at the yellow papers on the very back page, or not quite the back page, but the list there of all of the agencies who were involved is quite impressive, particularly the voluntary sector as well, because in the case when there is any kind of emergency to be dealt with, the people you can always rely on are the voluntary sector and the local communities, in the same way we're doing now because of the coronavirus. So I like your comment there that this list is not exhaustive, dead right, but it's really good to see the strength of the voluntary and community sector in Nottinghamshire. So just a comment, Chair.
Thanks, Joyce. Anybody else for Rob? No? Anthony.
Thank you, Chairman. I think it's just worth saying that in some parts of the country, there was a view that there's insufficient engagement with elected members in the LRF process. It is, of course, at its heart, supposed to deal with emergencies that are short-lived. It's never had to deal with one as protracted as this before. In any case, the reason that the leader wanted to establish this committee in discussion with me was so that our members were engaged in the coronavirus, either through receiving reports or through the type of scrutiny and challenge that we've seen this morning. And from my perspective, it has greatly complemented the work that we do through the LRF. And Rob has sat in on these meetings and he's fed information back in, which I think has helped the LRF understand the role of elected members much better.
Good. Thank you for that, Anthony. Michael.
Yeah, thanks, Chair, and I really welcome not only the report and the excellent work by Rob and his team, but the reflections by Anthony. You know, you'll recall I raised that issue at the last meeting, and Anthony, I think, helpfully has fed some of that information back up through his chains to government. And I do think whenever we get to a point where the clouds part on this awful period for us as a society, and we reflect on the machinery of public service that's helped get us through this, we need to make sure that we're sharing some of our best practice, because I think there are things that could be improved from an LRF perspective in terms of its interaction and engagement with community leadership and elected members, both as county councillors, district councillors, but also our members of parliament, you know, some of whom we have here serving on the county council as well. And I just think that's something that needs to be very carefully, calmly reflected on by the government about how that could be improved as an arrangement if we ever, God forbid, face another pandemic or emergency like this that is ongoing. Because I think the previous discussion actually highlights really well that there's a role not only to be played for operational leadership and expertise and professionals, but also a role for lay leadership and essentially elected members asking the questions that members of the public are asking from an innocent perspective, if you like, and not as professionals. And I think that improves things and makes us a better public service. So really welcome what Anthony's just said, but cracking report, Rob. And I know from speaking to people in Gedling just how exemplary the LRF has been here in Nottinghamshire, and that in no small part is down to your expertise, Rob, and you should take a large part of the credit for it.
Thank you, Michael. We'll pause while, Rob, you take a large amount of the credit for it. There you go. Take it on behalf of your staff and all the voluntary bodies that Joyce also mentioned as well. Okay, thank you very much. If nobody else has got anything else to say on this, I'm going to again take a vote now, please.
Thank you, Chairman. Councillor Bosniak.
For.
Councillor Bradley.
For.
Councillor Butler.
For.
Councillor Garner.
For.
Councillor Jackson.
For.
Councillor Knight.
For.
Councillor Payne.
For.
Councillor Rhodes.
For.
And Councillor Zadrozny.
For.
That's carried unanimously, Chairman.
Thank you very much. On to agenda item 7, which is the update on the economy and progress with the economic recovery plan 2020 to 2022. Matt Neal, I think you're leading on this, is that correct?
Yeah, thank you, Chair. Morning, members. Yeah, the report itself is updating you on the help for small, medium-sized enterprise businesses in the food and drink industry, and also to inform you of a business toolkit that we've created to support our food and drink sector, and then seek approval for its launch. As you're aware, the report itself touches on the number of services that the council provides in this sector, and touches on the fact that at the heart of all of that is local sourcing and using local providers for those services. It then touches on national initiatives, so DIT providing help to promote food and drink overseas, and also the expansion of the furlough scheme and provision of grants to Tier 3 areas for this help. Locally, there's a number of projects being led by the D2N2 LEP in relation to food and drink manufacturing, and also as a leading, we also have training through DBC, who are providing training and employment to help productivity and help support the food and drink industry. In Nottinghamshire, the plan is to obviously launch this toolkit. We've been working with internal and external partners in its development. Also, we want to support businesses in relation to the PR and marketing. These were some of the key themes that came out of the work that we did with our industry partners, and really wanted this toolkit to help them move forward. So the report itself obviously highlights all of that, and attached is the toolkit itself. Thank you, Chair.
Thank you, Matt. So members will see the two on page 38 there. They've got the two recommendations, which I'm going to move formally. Can somebody second that, please?
Yeah, I'll second that, Chairman.
Okie doke. Well, I hope members agree. Having said that we do more than just the statutory norm. This is something I think which is a very sophisticated reach out to the business sector, particularly those who have been badly affected by the coronavirus. Has anybody got any questions or comments they want to make on whether they think it's a good idea, a bad idea, whether they like to see improvements on it? I've got Alan.
Yeah, thanks, Chair. Very good idea, very good report, very good idea. And obviously, it's good to see early on in the report about the locally sourced fresh produce that goes into school meals and the meals at home that we provide. Although I'd be interested to know how much venison's included in school meals, but nonetheless, particularly about venison from Sherwood Forest, hunted with bow and arrow, I'm sure. So, but joking aside, it's a good report, and what I'm very pleased to see is the percentage of pupils that still take school meals in Nottinghamshire. Over 70% is very good, and it's good to see that such fresh, locally sourced produce goes into those meals, and that can only be good for the children.
Thank you, Alan. Yeah, Richard Butler, please.
Yeah, thank you, Mr. Chairman. Well, I was also going to wonder about the venison. It all sounds very grand, but yes, of course it's a good idea. This is, but I think it's a very interesting read in general, because whilst we all know Nottinghamshire very well, the various parts of it, I think anyone reading this from away from Nottinghamshire would be quite amazed at just how important the food industry and farming industry is, in particular to the county. I suspect a lot of people think we're just an urban county and very industrial. I'm sure that's an impression a lot of people get, which we know is anything well, it's just not correct. So yeah, I haven't really got any questions. I just to support this this idea, and also it does reflect the very good work that's been done by both the producers of the food, the farmers, but also the distributors and us, and ensuring that our residents are benefiting. And the point about the school meals as well. Yeah, they've got a very good good feedback and good response.
Thank you, Richard. Anybody else? Okay, Well, that's very positive. I think it is important. I mean, any county, not just Nottinghamshire, but relies a lot on the food and drink industry and the hospitality sector. It employs an awful lot of people. It sometimes can be confusing. So I think it is important that this is broadly advertised, because otherwise it's pointless if it doesn't get out there en masse. Having said that, then Alan.
Yeah, just a quick one, Chair. Sorry, I just noticed something. In the yellow pages, there are a list from page 24. There are a list of local producers, suppliers and manufacturers. This is clearly not an exhaustive list, but on what basis were these particular businesses included in this report?
Matt?
Yeah, so these were some of the obviously some of the stakeholders that we work with as part of the document. It is an exhaustive, Councillor Rhodes, and more than happy, you know, where we've missed any particular suppliers, to work with them, and also to flag as part of the publication of the toolkit.
Okay, Alan.
Yes, thanks. Yeah, that's fine. Thank you.
Yeah. Okay, thank you. Jo, would you like to read the names, please?
Thank you, Chairman. Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Butler.
4.
Councillor Garner.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. That too is carried unanimously.
Okay, thank you very much. And Matt, I think you're on the next one as well, which is agenda item 8, which is an update on the youth employment support. Would you like to address this report?
Yeah, thank you, Chair. So again, this is part of the COVID-19 Economic Recovery Action Plan, working this time in relation to the youth employment support, and highlighting some of the sort of contextual information in terms of where we find ourselves with youth employment, but also providing a sort of overview of some of the government initiatives and national initiatives. So the report itself highlights some of the statistics, which you'll obviously read, the universal credit stats, which show the doubling of claimants during the pandemic compared with the year previously. Number of national initiatives have obviously started and are starting to feed through into the economy. So obviously the Kickstarter programme, which most of you will have heard of, in terms of providing funding for employers to create 6-month job opportunities for our young people. For those young people who are at risk of long-term unemployment, but also, and we've also heard from the East Midlands Chambers of Commerce, where that's starting to feed into jobs and placements, and working closely with the businesses within the county. Furthermore, we're working with Futures and also DWP in relation to an introduction to the Kickstart scheme, and working on other initiatives such as the Restart programme. You will obviously have seen nationally the national minimum wage rise, and then further investment in skills through college investments and also in the school investments. The report also touches on Inspire, who are bidding for £12 million worth of projects relating to employment with partners. And the report then goes into the county initiative, which we'd like to deploy, which is an employment and skills brokerage and an online platform, which will help residents to be identified, and also for our our companies to establish the skills and qualifications for jobs within the county. And the ask of the report is that we can go out and procure this online platform in order to do this. Thank you, Chair.
Thanks, Matt. So I'm going to formally move that. You can see there are 2 recommendations there. Richard, can you second that for me, please, and I'm open to questions. Richard? Either Richard?
Yes, happy to second the recommendations, Mr. Chairman.
Thank you very much. Can I ask if anybody's got any questions or comments on that now then, please? Ben, sorry, Ben Bradley.
Thank you. Thanks. And really useful report. A couple of questions that came from it. Firstly, I mean, it doesn't stem from this report, but a previous conversation about employment figures and statistics. And I, in my parliamentary role, had a conversation with council officers about what facts and figures are available to the council in terms of unemployment data, and ended up going away to the Commons Library to find some more detailed localized information. And I guess my question on that front, therefore, is do you actually have the level of data that you would like in terms of assessing and managing the requirement for the figures in terms of unemployment? Because the impression that I got from those conversations was that perhaps that's not the case, and I wonder whether we could do more, if so, to gather that data from other third parties. The second part is around Kickstart. So obviously, for larger scale use for that scheme, we have to have these gateways or kind of umbrella organisations to group businesses together. I wonder if we feel we have kind of enough of those umbrella groups to be able to effectively make use of this scheme, or is there more that we need to do to try and support kind of businesses, people like, I know the Chamber are doing it, but other similar organisations, to be able to help facilitate those? Because I'm conscious that if we are unable to get those big groupings together, we're going to miss out on being able to do anything at the scale that we would like.
Thanks, Ben. Matt?
Thank you, Chair. Yes, so Councillor Bradley, I think in terms of the data, we're actually in a good place. There's been a lot of work going on with the DWP, taking statistics from the DWP, but also a lot of work with the Midlands Engine and also with the LEP and D2N2 LEP. So I think we're in a good place with data. However, that's not to say that we've got everything. So it would be helpful if we could obviously review that and look to your sort of help there in terms of being able to allocate to get to more information. But I think in terms of data, a lot of work has gone into this with DWP and Midlands Engine. I guess in terms of the other question about the groups with Kickstart, so again, a lot of work going on with local groups, Councillor Bradley, but again, it would be helpful to learn from members where there may be groups that we may not have been able to get to, and lots of work going on with the East Midlands Chamber of Commerce, as has been said in the paper. Thank you, Chair.
Thanks, Ben. Did that make sense?
Yeah, it did. I just wanted to kind of flag those kind of business groups on a smaller scale. I think particularly people like Ashfield and Mansfield 2020, for example, who have that business network. I know, having spoken to them, that they've been concerned about the workload in terms of acting as that kind of gateway organisation, and whether there's more conversation or more support that we could have there in order to help more groups to do it, and obviously we'll be able to do more at scale. And in terms of data, Matt, if there's anything particularly you would like that you are missing that I can go and dig away at on a national level, do let me know.
Brilliant, thank you.
It's very helpful, Ben. Thank you. I've got Richard Butler, Michael Payne, and then Richard Jackson, please.
Yes, thank you, Mr. Chairman. I was just wondering about, as ever, getting the message out, especially the proposed portal, online portal for the young people. I can see you're obviously taking that into great consideration, because how do you target the young people? And I know obviously futures will be a key to this, but is there also perhaps a way forward with the youth services, the youth clubs, for example, and various other agencies that are having day-to-day or certainly more regular contact with the young people?
In answer to the question, Councillor Butler, yes, we are working obviously with Futures, as you know, but also with other organisations like Inspire on this. There is no reason whatsoever why we wouldn't be working with the youth clubs and the services to promote the portal, and that's something that we'll do as we get further down the line with the procurement of the portal itself.
Thank you, Richard. Michael.
Yeah, thanks, Chair. Just two specific points on the procurement exercise. So, first of all, some thought about what's that going to cost us in terms of procurement, because obviously we know times are tough at the moment. We've got Councillor Jackson on the call, and there have been challenges for all of local government over the last year. So it'd just be helpful to know that for transparency purposes. More pertinently, how are we going to judge the success of the portal? It'd be really helpful to reflect now, Matthew, or if you can, maybe at the next meeting, how are we going to judge its success? And just finally, on the broader point, I mean, obviously this is hugely welcome. I suspect this area around employment is going to have to become one of the county council's top priorities as we move forward. One in 20 16 to 24-year-olds unemployed. A third in the first wave were furloughed or unemployed, which was double the national average. And we know, of course, that if somebody's long-term unemployed at that age, it can permanently stunt their job prospects for the rest of their life, which could then scar our own local economy. So, I just suspect this is going to become a real area of focus, and certainly should be. And I would plead that the county council should make this a top priority. And just the other point aligned to that, Chair, we should be doing all we can in the new year as we move out of hopefully the worst of coronavirus to coordinate efforts of not just the county council and city council, but the district and borough councils as well, to make sure that we're deploying full resource to try and tackle this problem, because it will not only impact on Nottinghamshire's economy if we don't get a grip on this youth unemployment crisis, it'll scar the nation's economy as well. So credit to Matthew for the practical things that he set out in the report. I think it's a very, very good report, and would just welcome his reflections on the cost of the procurement exercise and how we're going to judge its success.
Yeah, I think that's they're valid points. As we move forward, and hopefully as the clinical vaccines become more prevalent, we will still have an economic recovery to take place, and I think that's where this committee will move forward to. So at the moment, by necessity, we're dealing with primarily the medical issues, but as we go forward, I think it will be more economic issues like you just brought up there, Michael. I think it is a fair question, though. If we are going to have a procurement exercise, we do need to know whether they're succeeding or failing. So, Matt, have you got any ideas on that? I'm not putting you on the spot now. If you haven't, you can say so and we can come back next time. But
I think, Chair, if I can, we would like to bring back a report once the procurement is concluded, just to obviously let members know. Michael?
Yeah, so the principle is we need some parameters as to how we know that it's working. Rather, I mean, we're all in favour of setting it up, I think. We need to know that it's not just money that's going out there and just disappearing. That's fair, but we won't put you on the spot now. If you can come back with that, Richard.
Yeah, apologies if some of this has been covered because my connection went off for a minute or two. Looking at Appendix A, and it tells us that the Kickstart application is for a minimum of 30 job prospects, and I understand we can group and band together. I just wonder how we can get across to small businesses, that might just look at this and think it's not for them because it's going to be bureaucratic and because there's nowhere they can take on 30 people, that actually this can be done in ones and twos at that much smaller level. Because I think so many jobs, and those are the businesses really that are suffering the most, I think, over the last few months as well. So it's just how we get to them, how we can, they're not all, probably the majority aren't members of trade bodies and that sort of thing either. So just how can we talk to them?
Matt, any ideas?
Yeah, I guess picking up from the earlier comments with Councillor Bradley in terms of talking to some of those smaller businesses, we are linking in with the Chamber of Commerce, who do have that connection, Councillor Jackson. So that's how we're working at the moment. And obviously there's the brokerage at the LEP as well, which we're connecting to. So we're trying to cover as much ground as we possibly can and connect with as many businesses as we possibly can. Clearly, your help as well in that, in terms of any other stakeholders that we might be missing as part of that exercise would be welcome as well.
Thanks for that. Thank you, Richard. That's a good point. Ben, did you want to come back?
Yeah, sorry, Chair, I keep butting in multiple times, but
okay.
just came to mind the discussion about lots of kind of working together on a local level. I raised at a previous meeting of this committee that I'd had the similar conversation about the kind of brokerage and shifting people across different sectors with a variety of organisations, D2N2 and district councils as well as county. And I just wanted to check, I'm sure it has, but just to check that those organisations are involved in this discussion. What I wouldn't want to do is go and spend a lot of money on a platform that is duplicated by D2N2 and duplicated by local councils. Is there that collaboration there?
Yes, there is.
Yeah, and I think that should hopefully come back in your report as well, as has been suggested by Michael. So with your permission, we'll put that on the next work plan, Matt, if you think you can get that done in time.
That's fine.
And we'll bring that back. Is there anybody else before I move on to the vote? Okay, Joe.
Thank you, Chairman. Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Butler.
4.
Councillor Garner.
4.
Councillor Jackson.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. Also carried unanimously.
Thank you very much, everybody. So that's it. There's only the work programme there. I've just mentioned one thing. Is there anything that anybody wants to see come on? We've got some ideas going forward, particularly around the economic recovery aspect of it. But if there is anything you want to go on, all you need to do is email either myself or Anthony, that will be fine, or Derek. With having said that, if there's nothing else, I'd like to thank all of you. That's a very positive meeting. And once again, if we can thank the staff for what they've done. This is the last meeting of the year. I think it's been, we didn't know what to expect with the committee or where we were going to go. And we are at least ending, I think, in a place where we never thought we would be, I don't think, in March. And as I say again, I'm immensely proud of what this country has done in terms of the COVID vaccine. And I wish you all a Merry Christmas and Happy New Year. Thank you very much.
Thank you. Bye,
Bye.
everybody.
Thank you.
Bye.